go slow to go fast is actually targeting the workplace.
Sometimes it affects your mental state as well.
Yes.
We are here for you.
I think the best thing to do is, I think we look at the baseline, how they are usually, and if you see there's a change in their level of baseline, usually, let's say for an example, a person is very cheerful, very happy-go-lucky like, and suddenly you see he's very quiet, he's not talking, isolating himself. There's a change from baseline, there's a triggering or warning signs that you might want to have a look at, hey, what's going on, you might want to have a chat with that particular person. That's number one. Look at the baseline. If there is a change from baseline, there's a trigger sign. Number two, then you might want to look also into the function of the particular person. If a person works productively, then suddenly you start having issues in his work. For an example, the level of work that he's doing right now is not up to the par that he has been doing before this. He's still able to complete the job, but it's taking more longer than what he's supposed to be. Start making mistakes at workplace. These are all triggering factors that you might want to have a look at and have a chat with that particular person. Apart from that, it also depends on what he's experiencing. Sometimes people start isolating themselves, not really talking to others, and these are all trigger signs that you might want to have a chat with that particular person and support and give them resources and tell them if they need to go and see and seek a professional help.
A lot of time, people also are quite good at masking their symptoms, yeah? Because it's like, no, I cannot allow people to know that I'm feeling this way or thinking this way, you know. So initially, they are still strong to put up the front. So this is where their loved ones or even fellow colleagues or friends may not realize things has been changing for them. So because they are masking it or holding it back, right? And this is the unfortunate part, because this is where if they would have gotten help at that point, they would not have fallen down to be so much more chronic later on, you know, in the illness, you know, when the signs and symptoms are no longer able to be kept, and that's when everybody knows that he or she is unwell. Yeah, so for us, we always struggle when they come, it's really at a very bad stage. Yeah, so this is where I think campaign like that is so important. Please talk to someone to get help, to get assessment. Yeah, especially when you sense that you are struggling. Yeah, in terms of thought, emotion, that is the first telltale. You know, why am I having so negative thoughts? I'm losing all my motivation, my confidence is not me. You know, or how come my mood is swinging? Yeah, or my mood is so down. Yeah, so this is the awareness that we have been trying every year, and of course today is World Mental Health Day. Yeah, so again, maybe at this point I want to highlight to the audience, the theme for 2020 World Mental Health Day is mental health for all. Greater investment, greater access. So greater investment doesn't mean that services. Greater investment means every one of us, please invest time to take care of ourselves. And then hopefully greater access, referring to us accessing services ourselves, and of course us the professional. Hopefully in whatever setting we are able to provide access to services. And that's what Souls Health has been doing very hard the past few years.
Especially now because COVID has changed for everyone. People who are high-functioning, normal people start feeling distressed and like they don't know what's going to go on because they don't know whether they're going to have jobs or not, whatnot. But this question though, I'm going to flip it around. Because there's a term where you can drag a horse to water, but you can't force a horse to drink. What if you detect this person has some mental condition? I'm not going to call it a disorder, but this person refuses to seek help. What would you do?
Okay. In this case, we need to understand that that person requires a lot of time and support in order to understand and accept that yes, I'm going through something. And we already, as we mentioned earlier, there are a lot of stigma and stereotype in the society. If let's say they're an working adult, okay, if I'm going for a work, will that affect my, going for a psychologist or psychiatrist, will that affect my job? Okay, all those things are running in their mind. So when they are denying the fact that I need help, what the best that we can do is the people around them. to provide the support to ensure that regardless of what, okay, no matter what condition that you are going through, regardless of what, you will be treated as it is. Okay, you are not going to be treated differently. So this is a very important thing that to instill in them, and also slowly tell them how this support can help. You don't have to force them, okay? You can tell them that, okay, how counseling works, or probably you can tell, oh, there is an help. You can share like, general topics like that, and we need to normalize the conversation of mental health in the family first. To take it, to make it more relaxed condition where we are free to talk about emotions, we are free to talk about our struggles. So these are the kind of steps that family members or even friend circles, you can do that. Give that support, give that assurance, regardless of what, we are there for you. That will move them a little bit closer to us. So we cannot just chip in and say, hey, come, I'm going to help you, though we are available, but that person needs to be ready. So we need the society to help us to do that.
Yeah. One thing also is that, and this is a real life situation where I've actually seen, is someone having a mental condition in the office and not being able to function to their optimum level. And every time anyone mentions that, I think you need help because you're affecting our work as well. No, I'm fine. And then they go into a poor me situation where they break down and cry, why are you attacking me all the time?
Right.
Are they in a state where they're concerned about losing their job if they admit that they have a mental condition? So how do you help someone like that?
This is the part that I see. I go back to the theme for this year, the greater investment, greater access. And Lakshmi talked about just now at personal and family level. This whole campaign, go slow to go fast, is actually targeting the workplace. So precisely, at all levels, personal, family, workplace, and the community, we need to put in, the proper support. Let's say at workplace, if the whole company, right from the top leadership, endorse that we care about mental health as much as physical health. We have all the panel doctors and hospitals listed in Malaysia, but why are we not providing the mental health services listed for our employees? So that in circumstances like that, if the company already has this forward support, an employee will feel differently, that if I feel that I'm too stressed out, I have the access to the services provided under my company to get mental health support, and then they would not be going into that mode that you're talking about. No, I'm going to lose my job if people know that I'm depressed, and so on and so forth. So I think that's why Soul Self and Symphony Learning chose the workplace as the main focus of this festival or campaign, because workplace is one of the biggest population that we need to target. So a lot of work that we still need to do. You can see my
So basically the bosses or the company says, look, we know the job is stressful. We understand that sometimes it affects your mental state as well.
Yes.
We are here for you.
Correct.
Then people will be more open to...
Yes.
As well as, I think you also need to maintain and promote the mental health well-being. So the prevention.
Right, okay.
Before it
actually gets bad.
Exactly,
Right.
exactly.
Can I just add on one more thing when
Yeah.
you're talking about the way they are saying it, okay? Let's say you are a teammate, you're working in a team and you found someone is having the difficulties, from the top management level or even from the normal group mates, okay? Choice of words is very important. When you go directly and tell that person, hey, I feel like you need some help, probably you're bringing our team down, you're already demotivating
Right,
that person.
okay.
Unless you're putting it another way, like I've seen, monitored or I observed that you're feeling very weak lately or you're feeling not so okay. Is everything okay with you? Is there anything that you would like to talk to me? Put yourself there too as in support. Then you can promote the mental health by saying, why not we get some help? That will definitely help you to bounce back, and of course as a team we care for you. See, the choice of words matters a lot.
How and what you say, because immediately they have this defense up already.
Yes,
They're
yes.
ready to fight back and everything, right?
Usually feelings, and feelings create bondings, and
Yes.
that's how you start it.
Right.
Talk about feelings and create bondings, and easier for the person to open up later
Right.
on. Yeah.